Joining me now is Dr. Alexandra Yamshikov. She's an infectious disease physician with Rochester General Hospital, and Dr. Mary Rose Laguio-Villa, an infectious disease specialist as well, also with RGH. Thank you for coming in.
Thank you.
Let's get right to the basics. What is COVID-19 and what are the symptoms?
So COVID-19 is the name of the symptom complex that has been associated with infection that is caused by the novel coronavirus that we're hearing in the news about. And the symptoms that go along with this illness are primarily respiratory. There is a component of fever. There's a component of a dry cough in most patients, as well as in the more severe cases, there's shortness of breath and more respiratory difficulties that result in hospital admission for some.
And there are a lot of viruses that go around every year. We get this question a lot, especially now with the flu, killing more people each year than coronavirus, and mostly the same demographic. We're talking about the elderly, people with underlying illness. Why is COVID-19 triggering such a massive response?
Well, I think one of the reasons there's such a massive response is because there's a lot of unknowns. So although we know it can be similar to flu, it's unpredictable as yet how long this will last, and it's also unpredictable how severe it will be. You know, this has been a new viral infection that has not been seen in humanity, and we haven't seen a new infection like this in decades. So because we can actually identify what is the virus that causes this bad infection, and we see how rapidly spread is going, I think that creates a lot of concern. But at the same time, I'd say, you know, this may be also a product of us having such advanced technologies. We now have an ability to identify what it is. We know what it looks like. We're able to really see who it affects and how it affects people differently.
All right, so what's the best way to stay healthy right now? A lot of people are at home and they're worried about their older relatives, their young children. If you're at home, what are you doing to stay healthy?
Well, the main approach would be to stay home. So what they say on the news and what they recommend from the health department and from the WHO and from the CDC, all of those recommendations are valid and important. So the social distancing measures that have been recommended in the community are the way that we're all going to stay healthy together. So that's how we're going to protect our elderly. Some of the other restrictions that have been put in place for visitors in the nursing homes and in hospitals, and some of the closures that have been associated with the increase of activity in our area are all part of that. They're all part of the social distancing that we all have to do to make sure that our community stays healthy.
All right, we have a viewer question, so for that, let's send it back to Adam.
Thank you, Maureen. Tom in Rochester is asking this: can CPAP machines be a place where COVID-19 can breed and infect users? Should extra care be used in cleaning these CPAP machines? So again, this is Tom in Rochester, a question for our doctors.
What about?
That's a really good question, Tom, and I can see why someone would be concerned about a CPAP machine being a venue to catch COVID-19 or the virus from, but generally how we catch this infection is by common contact with surfaces. So if you were to share your CPAP machine with another individual in your household, which is uncommon, but that might be what you do, then we would recommend that you take the additional barrier. So it's the extra cleaning with approved products such as bleach or other products that are approved for viruses to prevent you from transmitting your infection to the next person. I think in general, by using a CPAP at home, it isn't traditionally felt to be a way that we transmit. And also, I think if you know somebody who has a CPAP machine, it really is a sealed and closed device. So the kind of exposures that we'd be most worried about are aerosolized generating procedures. So sneezing, coughing, where that respiratory wetness can go out.
Okay, here's a question. If my children obviously are home, but I'm going off to work every day, aren't I putting my family at risk of exposure because I may be at risk of exposure going out into the community and coming back at the end of the day?
That's a very good question. So there, with all the closures and restrictions that have been put in place so far, it is very difficult for parents to sort of go on with sort of the daily routine and the daily schedules of their work and care for their family. Not everyone is going to be able to stay home just because the kids are home. So that is a valid question of, if one of the family members is going out of the home, what are they bringing back? But the goal, the overall goal, is to, if there is some transmission going back and forth, by not having everybody go out and sort of do their own thing every day, hopefully we will be able to limit the spread by that. We're not going to be able to grind society to a halt completely to stop the spread of the disease. We'll have to make sure that we continue to function as a community, but some restrictions do have to be put in place to help mitigate some of those risks.
Right. Another emphasis on not panicking. That's good.
Exactly.
All right, we've got another viewer question. Adam?
This one, by the way, Maureen, a lot of people have been asking. I've seen this out on social media. Sharon Ellison is asking, what should pregnant women be doing? So a very important question. She wants to begin with the basics there. So we'll give this one over to our doctors.
Yeah, that's a great question. I mean, I know somebody who's planning a baby shower.
Right, right.
Tough time.
And, you know, I think that we know that pregnant women are vulnerable to bad outcomes from other viruses. Like a 30-year-old woman who is pregnant and gets flu has the higher risk of having a bad outcome from a 30-year-old woman who does not have, who's not pregnant. But I believe that the last time that our institution was on, there are weekly calls from the CDC for updates when they gather this information. And the last information we know is that there is not evidence to show that pregnant women are at higher risk for adverse outcome if they get infected with this virus. Now, that being said, I don't think that means that they should not take all of the recommended precautions. You know, we really should make common sense hygiene more habitual. So frequent hand washing, accessibility to hand sanitizers, being aware of your surroundings, avoiding crowding, avoiding individuals who are also experiencing some illness or respiratory infections. If they are around anyone who coughs or sneezes, keep a distance of about 6 feet. Encourage that person to cough into their elbow or into a tissue. So I think particularly if you yourself are pregnant, or if you're around other pregnant individuals or other vulnerable individuals, to be extra cognizant about this respiratory and social hygiene.
All right, Dr. Yamshikov. And
if I could actually add to
sure.
that would be great. So this is the time where we really have to approach community living differently. So that baby shower that you mentioned, this is the time to think about how we can still maintain those connections and stay together and maintain those family ties without necessarily having that focus around a communal meal or a communal baby shower. So maybe consider, you know, sort of a book exchange on each other's porches, or having conversations via Skype or FaceTime, and using some of those modalities that we have. Because, you know, this is not really the time to throw a huge baby shower, you know, with what's going on.
All right, Dr. Yamshikov, thank you so much. Great answers. Dr. Leguizamón, thank you so much. And we will be leaning on you for sure in the days and months to come.